As you mentioned, my name is Lisa Ronquillo. I'm a public health analyst. I work in San Francisco, and I work for the Department of Health and Human Services for the Health Resources and Services Administration, and specifically for the Bureau of Clinician Recruitment and Service. And we oversee a program called the National Health Service Corps. Are any of you familiar with National Health Service Corps? A little bit? You heard about it? Okay. Well, good. This is great because now you're a prime audience for me to tell you all about it. So I'm not going to read to you from the screen. It's a pet peeve for me to read what you can read. But basically, the essence of National Health Service Corps is that these are a group of individuals, providers, willing and committed to serve in underserved areas, providing primary care services to communities in need. And again, as I mentioned, the National Health Service Corps is administered by the Bureau of Clinician Recruitment and Service and is part of the Health Resources and Services Administration. Just to give you a few facts and figures, right now about 1/3 of primary care physicians are over the age of 55. 22% are doctors, MDs, going into primary care. And there are an increasing number of nurse practitioners and PAs entering into the workforce. However, we also have a growing and aging U.S. population, and over 60 million Americans currently live in what is called a health professional shortage area. So there's not enough services and providers to meet the needs of the people. And at this point in time, the community health centers, and are any of you familiar with community health centers? Okay. Well, these are health centers that receive federal funding, also from the Health Resources and Services Administration, and they provide services to those who are underserved, uninsured, and underinsured, and they provide services regardless of their ability to pay. And right now, they're actually experiencing an increase in funding to expand. They're building new sites, they're expanding their services, and with that, we need providers to meet those needs. This is a little outdated. It is from May of 2010, but this is just to give you a picture of where all of these approved sites are where you can work. So the National Health Service Corps has designated these sites that are in these health professional shortage areas for loaner payers and scholars going through our program to provide services. And just to give you a little bit of numbers, right now as of, well, not now, but as of calendar year 2009, 18.8 million patients were served at community health centers. And 92% live at or below 200% of poverty level. So there's definitely a lot of need out there. So this is the website that if you go to the National Health Service Corps, nhsc.hrsa.gov, they just actually refreshed it or revamped it completely. They've made it really user-friendly, and all the information that we have access to, you have access to. And so I would encourage you to check it out. You can add it. We're also Facebook, YouTube, Twitter. So we're really trying to meet you where you are. So they have come a long way in terms of using social media. But just to give you an example, in fiscal year 2010, we had in our field strength, which is basically the number of current providers and participants in the program, we had 7,530 clinicians in the field, which is twice the 2008 level. And our projection for fiscal year 2011, which we're pretty much on target for, is to be about 10,500 clinicians. So that's tripling the 2008 level. So we're really excited. 5,812 of them will be loan repayment awards. And we're also looking to fund about 230 scholarships. And I'm going to tell you a little bit more about those two programs. So, let's see here. So basically, this is what you'll see on the web page. And I think I have another slide that goes on further detail about this. But this looks pretty attractive, right? You can get up to $170,000 in loan repayment. So this is a 2-year initial sign-on. So it is your commitment to serve full-time, or you can serve a part-time or half-time for 4 years. And so this, what you don't realize is this is actually an increase. So last year, fiscal year 2010, all the applicants that applied had an initial sign-on of 50,000. So this is actually an increase, and we're really excited about that. Also, we're now making half-time service available, and that was at the at the request or at the demand to meet the needs of the providers these days, young families, some want to do teaching, and so they've actually made a half-time service available for 30,000. So we're really excited about being able to meet your needs as you're meeting the needs of the community. What's exciting is after the initial 2-year, depending on where you are with your loans, if you have qualifying educational loans that fit, that meet the need, please don't consolidate them with anything non-educational, like a car, a boat, anything like that. But assuming that you have those needs for your loans, you could in 5 years potentially get up to $170,000 in loan repayment. We do have dentists and other providers that are beyond this in terms of their debt, and they're able to continue on an annual basis. Right now we have about 75% of our National Health Service Corps providers remain in service even beyond the completion of their service obligation. This is just to give you an example of the different disciplines that are eligible to apply. And I know that there was a question, and I don't know if the person's in the room, there was a question about registered nurse. So are any of you ladies ones?
No, they didn't come.
They didn't come. Okay, well, I know Dr. Withy, you will definitely pass this information along. So currently, registered nurses, we don't have a specific place in this program. We did have a ready responder program that I believe is possibly being phased out. So one option, if you want to maximize both programs, is to continue and do advanced education and become a nurse practitioner. You can either apply for scholarship to pay for that training, or you could go through loan repayment when you are completed that. So that is an option, and I wanted to make sure we got that on video. If you're wondering about where you'd be serving and all those dots that we saw on the map, they're in a variety of locations. Some are even private practice. We do have some sites, but the majority are at our community health centers. And with that, your salary and benefits are very competitive. I want to make this very clear. You're not working in exchange for free for the loan repayment or scholarship. You will receive a competitive salary. It will be commensurate with your peer group, as well as to that of a federal employee. You would also receive malpractice and tail coverage when working at one of our community health centers. And so they're just great benefits to you. Truly, we want the loan repayment to be to ease the burden of the debt, so that you can focus on clinical practice and care and not have to really worry about how you're going to pay off your school loans. So we also have National Health Service Corps clinicians working in Indian Health Service locations, prisons, state and federal, and just want to clarify, it does not have to be a nonprofit organization. So again, you must have a license to practice in the state where you work. Again, the loans, please make sure that they are not consolidated with anything non-educational. One thing I would like to also point out is, and it's been a slight change, in the past you would have to take that entire lump sum and pay it directly to your loan, to your lending institution towards the loan. And they did find that, I believe Sallie Mae is one of the lending institutions, they require a monthly payment. And so the policy office did determine that it's okay to take that lump sum and set that up as a direct debit monthly to satisfy that payment. So that's a new thing, and it's a good thing. The other good thing here is, in order to be eligible to apply as a loan repayer, you must first be working at an approved site. So I encourage you, even while you're a student, to explore where you think you might want to serve. Establish a rapport with the community. Go check it out. See if you can do an internship. You know, the more you become familiar with the community, with the clinic, and they become familiar with you, you can really start to find out if this is going to be a good fit. Because we want not just during the time that you're paying back your service, but we're also wanting you to stay in place in this community. There's a lot of trust that's built with the patients and with the providers that you work with, and so as turnover can have a negative impact on patient care. So again, they must be located in a health professional shortage area. One feature on our website does have the ability for you to search by address and city and state to determine if a health center or a clinic or a location that you might have in mind is located within a HPSA. And I would encourage you, even during your residency, to go on those interviews. When you make an interview, they're not just interviewing you, but you're interviewing the site. So ask the questions. Make sure it's going to meet your needs long term. And if you have a spouse, you can inquire about what opportunities are available for your spouse to work in the community. If you're planning to have children, these are all the things that you should consider because we want to get a good fit up front.
Can I ask a question?
Yes.
So when you talk about the repayment of tuition,
yes.
What's the scenario if a student, say they had $30,000 of college debt, and then they went on to medical school shortly thereafter, and then they added let's just say $120,000. They went to a state school and it was $120,000. So they now have $150,000 of loans.
Yes.
Can they use the National Health Service for loan repayment program to pay towards the full $150,000 they owe, or just towards the $120,000 of medical school loans they have?
It's a good question. So thank you for asking. Actually, all qualifying, even undergraduate, any educational loan that has helped them to get to in their career, get their licensure and credentialing, all of that, working towards that profession, that does count. So at the time of application, they would include all of the various loans. And so the initial $60,000 would go towards it, and then again annually they can come in for a continuation application, and then actually that third year they get $40,000. So that's a little bit of a retention tool.
Great.
Yes, definitely.
I saw that if you work 6 years, you get the whole amount paid, it said. So if you work 5 years, you get $170, but if you work 6 years at full time, it's...
I think it was worded a little bit different. I think they were trying to word it that you could work and have your whole debt paid. So
okay.
Basically, the 5 years, they did the calculation for the $170,000, but as long as you continue these continuing applications every year, you can work until...
$30,000 a year?
And actually, towards the end, it gets closer to $15,000.
Okay.
Yeah. But
Okay, so if you had a $250,000 debt, you couldn't do it in 7 years, you'd have to be there longer.
no, you'd be there longer. But you know what? What we find is most of our providers have a heart to serve the underserved. They're passionate about what they do, and they're just doing what they love. And so this is actually a bonus. And so if they already know that they're going to work and practice, it's not too big of a deal. Welcome.